Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Maungwa is with me on the sign language desk. This week, the district teams, the health teams, continued the great work of rolling out the phase 1 of the national vaccination program throughout the whole nation. Many healthcare workers have therefore been vaccinated. Many other people out there are eagerly waiting for their turn and have asked when they too will be vaccinated. This is a very good question, really, as it's an indication that most people are now ready to receive the vaccine. There are, however, some who are still not sure if they want to be vaccinated or not. They are basically hesitating because they have a lot of vaccine fear and are rightfully asking a lot of questions about the vaccine. Most of the hesitancy is really being driven by misinformation out there. My update today is therefore going to continue focusing on vaccination questions and misinformation as we did last week. But first, let's review our recent COVID-19 statistics. As of Thursday, 4 March 2021, Zimbabwe's cumulative number of COVID-19 cases was over 36,000, with over 33,000 recoveries and 1,478 deaths. Bulawayo and Harare metropolitan provinces continue to have the highest cumulative numbers compared to all other provinces. This week, the country's epidemic curve is back on track, showing very good downward trend. The pandemic is therefore being brought under control. This is the way we also need to appreciate. We also need to therefore make sure that our vaccination rollout program continues smoothly to support everything else we have been doing. A lot of progress has indeed been made, as indicated earlier, with the cumulative total number of vaccinated healthcare workers now over 21,000. We are, however, still far away from vaccinating all our healthcare workers in both the public and the private sector. Hence, the need to vigorously address the issues that are creating vaccine fear and hesitancy so that we can ensure that everyone has the correct vaccine information and is ready to get the vaccine on a voluntary basis, of course. More people just need to be vaccinated if we are going to have the herd immunity. So who exactly should be vaccinated? People have continued to ask this question, especially during this week when we're vaccinating healthcare workers. Some people seem to think that vaccination is for frontline workers only. This is not correct. All adults should be vaccinated, but of course it's on a voluntary basis, as I have indicated earlier. Government in its post-cabinet briefing of 9 February 2021 specifically indicated that the intention is to reach 60%, at least 60% of the population using vaccines that are chosen based on science. Priority is, of course, to be given to healthcare workers since they are at the highest level of risk of contracting this disease. This is what we were doing this whole week, prioritizing our healthcare workers. The second issue that has come up, does this vaccine really work? And if so, how exactly does it work? Yes, the vaccine works. And this has been demonstrated in clinical trials that were professionally conducted and published. The vaccine is an inactivated or killed vaccine, or rather virus, as I've said here before. When one is injected with the vaccine, it triggers an immune response. In other words, the person's body begins to produce antibodies. Sometimes we refer to them as soldiers that protect the individual from contracting rather the actual deadly disease or virus. So what should one expect before and after vaccination? Some have also asked. Some misinformation has really been circulating in this area, and we observed this during the week as we're vaccinating healthcare workers. So before you are vaccinated, a trained healthcare worker provides you with the details about the vaccine, including its name and any potential side effects and how these side effects can actually be managed. After the vaccination, one receives a vaccination card that indicates the name of the vaccine once again that you have received, the batch number for that vaccine you have received, the expiry date, the date when the vaccine was actually administered, and finally, the name or the signature of the healthcare worker who would have administered the vaccine. The card also indicates when you should present or come back for your second dose. The fourth area that people have continued to ask with a lot of misinformation, what exactly are some of the expected vaccine side effects? And if one gets these side effects, can one still go on and have a second vaccine dose? Well, side effects for Sinopharm vaccine, the one we are rolling out now, can, like most similar vaccines, they can include pain at the site of injection itself, can include mild allergic reactions or rashes. These are very common. Some expected side effects, such as fever or feeling chills, might actually be an indication that the body has started producing some immunity, those antibodies I was talking about, which is a very good sign indeed. Because most side effects are very mild and can successfully be managed, it means that individuals can and should go on to have their second dose. Severe side effects are rare, but most of them are actually very easily managed as well. They can successfully be managed. So once again, there's no need for people to fear going for a second dose. Let me take this opportunity to remind you that all medicines and vaccines, including very simple over-the-counter medications such as paracetamol, for example, can actually cause side effects. There is therefore no need to fear vaccinations. These minor side effects are well known and they can be managed appropriately. The next area that people have really struggled with, what exactly do we mean when we say side effects can be successfully managed? One of the most important strategies in our national vaccine rollout strategy is on training healthcare workers, because these vaccines are to be administered by trained healthcare workers only. Healthcare workers are not only trained on how to administer the vaccine, but they are also trained on how to diagnose and to treat any side effects, mild or severe. This includes providing correct guidance on how side effects can be handled at the clinic or at home. The most important thing is to let your healthcare worker know if you experience any side effects, so that they can help and advise you on what you should do. So this is what we really mean by we can manage them well. Let me repeat what I said last week. Getting the COVID-19 vaccine is advisable. Everyone, including those who have had the disease and have recovered, should just get it. It really helps create or boost up your immunity. Lessons that we have learned from this first week of our vaccine rollout are going to help us revisit our approaches and hence strengthen our implementation the way we have been doing things. This, however, can only happen if you out there, you are on board. Let us therefore continue to work together. Your questions are very useful as they enable us to focus on what matters the most. After all, it is your health. It is you that we are trying to protect. Finally, let me take this opportunity to congratulate those who went on to volunteer and were vaccinated. Well done to you. It is really great. You're protecting yourself and the population. For those who have not received the vaccination yet, well, your chance is definitely coming. In the meantime, though, let us all, whether you have been vaccinated, not vaccinated, let us all continue paying attention to all those preventative measures that we have continued to talk about here every single week. Let us continue washing our hands with soap and running water, sanitizing our hands with alcohol-based sanitizers, and of course social distancing, staying away from those big gatherings, and yes, let us always wear a face mask and do it properly. Thank you.